Hi, Med P.
Hi, Dr. K.
How are you doing today?
I'm okay.
Okay. So you're here about a year after your last visit. Any specific issue that brings you in today, or are you just here for a general checkup?
General, and I'm also having some abdominal bloating.
Okay. And when did this start?
A month ago.
Okay. Do you think that it coincides with your cycle?
I don't know.
Okay.
It's hard to tell, honestly.
Okay. All right. So first, can you verify your last name and your date of birth?
June 2nd, 89. Last name is A-S-M-R.
Okay. And your phone number?
772-290-6601.
All right. Okay, so I'm going to ask you a series of questions about your immediate family. So if any of these conditions or issues applies to, say, your parents, siblings, or grandmother, grandfather, go ahead and say yes.
Okay.
Okay. Any clotting disorders?
No.
Okay. Breast disease?
No.
Okay. High blood pressure?
Yes.
Okay.
My dad's side.
And do you know if the onset of that was after age 50 or?
Yeah, it was definitely after the age of 50.
Great. Blood clots?
No.
Osteoporosis?
I don't know. No,
Okay,
I don't
no.
think so.
A heart attack before the age of 50?
No.
Okay. All right. And have any history with anemia?
Yes.
Okay. When did that start, and do you still have issues with that?
To be honest, I don't think I've had any issues lately. It did start when I was little. I was about 7, 8 years old.
And were you treated for it with any supplements?
Yeah, I
Iron?
took lots of iron.
Okay, very good. Do you have frequent headaches or migraines? Any history with that?
No.
Okay. Diabetes?
No.
Any thyroid issues?
Yes.
Okay.
Hypothyroidism.
Okay.
Diagnosed about 5 years ago.
Okay. Okay, and were you treated for that?
Yes.
And your thyroid is?
I took levothyroxine, and I stopped about 3 years ago.
Okay. No issues now?
No.
Okay, good. Okay, shortness of breath?
No.
Okay. Do you smoke?
No.
All right. Do you drink alcohol?
No.
Okay. Do you exercise regularly?
I try.
Okay. How often and what kind of activities do you do?
I do lots of cardio and strength training about 2 to 3 times a week.
Okay.
45
Nice.
minutes.
That's
session.
fantastic. Great. Okay. I'm going to ask you just a series of questions about your gynecology history.
Mm-hmm.
Then we'll begin the exam.
Okay.
Do you have any history of pelvic disease?
No. Not that I
Okay.
know of.
Any surgeries in the last 5 years that I should be aware of?
No.
Okay. Abnormal pap report?
I had one maybe 10 years ago, and they had me redo it in about 6 months, and it came back normal.
Okay.
After that.
Okay. Very good. Yeah, a lot of times you can have false abnormal results, so I'm glad that that was resolved. Positive HPV test?
No.
Okay. Any STIs?
No.
Vaginal infections?
No.
And did you get the Gardasil vaccine?
No.
Okay. Are you interested in receiving that?
No.
Okay. Your first day of your last menstrual period?
About 2 weeks ago.
Okay. And are your periods regular?
Yeah.
Pretty consistent time-wise?
Yes.
How long does your flow last, like per period?
About 4 to 5 days.
Okay. And so you said you're having abdominal discomfort, bloating. Would you say that it's cramping as well or just bloating?
Just bloating.
Okay.
No cramping.
Okay. Do you have a high sodium diet?
No.
Okay. All right. And are you sexually active?
Yes.
Okay. Do you use form of birth control?
Yes.
Okay. Excellent. Okay. If you don't have any more questions, I'm going to go ahead and begin the exam. We're going to start by doing your vitals. Then I'll be moving on to palpating your lymph nodes, doing the breast exam, abdominal exam, and we'll move on to the pelvic exam.
Okay.
Okay? I'm going to have you change into a gown. If at any point you feel uncomfortable or you want me to stop the exam, always let me know, okay?
Thank you.
Right. Okay, I'm going to start by sanitizing my hands. We're going to get your temperature and oxygenation. So if you could give me your index finger. Very good. Okay, 98.1. That's perfect. And okay, your heart rate is 80 beats per minute. Your oxygenation is 99% at room air, so that's normal. Okay. I'm going to go ahead and use this arm to get your blood pressure.
Okay.
Just keep your legs uncrossed for me. Okay, you're 115/75, so that's excellent. Not too worried about that. Okay. And do you know your approximate height?
5'3".
Okay. And I didn't ask you before, but are you taking medications on a daily basis?
No.
Okay. Do you have any allergies to medications or anything?
No.
Okay, I'm going to be using latex gloves. Do you have any latex allergies? No. No? Okay. Okay. So I'm going to palpate your neck and your lymph nodes, and also I'll be touching your neck just to feel your trachea and your thyroid gland, okay?
Okay.
Okay. Non-palpable pre-irregular lymph nodes and post. Any pain here? No. Okay. Just palpating the sinus cavities, making sure you don't feel any swelling. Okay, I'm going to palpate the trachea. Your thyroid feels normal and healthy, so that's good. I'm going to unbutton the gown just a bit so I can palpate your collarbone.
Okay.
Just feeling for any lumps or inflammation. So no abnormalities here. Next, I'd like to palpate your armpits. So if you could take this hand, put it behind your head just like this. I'm going to be palpating just to feel for anything abnormal, okay? Good. Okay. Okay. Go ahead and we're going to do the other side. All right. Okay. All right. All right, feels very normal. Everything's great so far. I'm going to go ahead and begin the breast exam now. I'm going to start just by visualizing the breasts, okay? I just want to look for any discoloration or any inflammation, any signs of abnormal discharge.
Okay.
Okay. Okay. Okay, I see the breast tissue looks normal. I don't see discoloration and it looks symmetric. So, do you have any breast pain before your period?
Sometimes,
Tenderness?
yeah,
Okay. Do you take anything for it?
No.
Ibuprofen really helps. So if you are comfortable with that, I can write you a prescription for extra strength ibuprofen just to take in the days before your period.
Okay.
Yeah. So next I'm going to be palpating the breasts, all right? Just going to be lifting the gown and just feeling for any lumps, okay? So you're going to feel tenderness, but it shouldn't feel painful, okay? But if you feel uncomfortable, just let me know. Okay, that's perfect. Feeling a little bit of fibrous tissue, but no lumps. Okay. I'm just going in a slow circular motion, which is something that you can do at home. I don't know if you give yourself a breast exam, like sometimes in the shower, it's the best way to do it because the warm water opens your blood vessels. So just a slow circular motion, maybe once a month in the shower. And I'm just feeling for lumps. I don't feel anything here, so that's good. I'm going to go to the other side. Okay, so same thing here. Just going in a slow circular motion. Okay, everything feels normal so far. Okay, just going to the side here. Okay, I don't feel anything palpable, so that's good. You can go ahead and button this back up. Okay. And I'm going to have you lay down and we're going to go through the abdominal exam. You're experiencing bloating right now. On a scale of 1 to 10, how would you rate it?
4 or 5.
About a 4 or 5, okay. So I'm going to try to go gently on you, but it is important that I really palpate and listen for different sounds just to see if I can try to alleviate some of these symptoms by knowing what's going on.
Okay.
Okay, so go ahead and lay down and we'll begin that. So I'm going to start by lowering the blanket and lifting your gown just so I can expose the abdomen. Okay. Okay, very good. Okay. Okay, so I'm going to start by just palpating.
Okay.
Just feeling your organs. Okay. Do you feel any pain?
No.
Okay. Okay, your uterus is normal in size. So I'm going to go a little bit lower to palpate your lymph nodes and your ovaries. Okay. Feel normal. Okay. Okay. I'm going to listen to all 4 quadrants of the abdomen with a stethoscope. You're going to feel kind of a cool pressure, so just letting you know. Okay. Okay, I'm hearing normal vegetation sounds. No excess acid buildup. Okay, everything sounds normal to me. I'm going to do some percussions, okay? Okay, sounds are normal. I'm going to be taking some measurements of the stomach just to look for symmetry or signs of edema. Actually, use this. Okay. Okay. 13 of this was 13.5. Okay, just a couple more. This one here is about 1 centimeter. Okay. All right. So everything looks normal so far. I'm going to move on to do the pelvic exam. Okay. Okay, if you could scooch a little bit closer to me, just come down a little bit. Very good. Okay, I'm going to open the gown. Okay. Okay. So first I'm going to visualize the opening. I'm not seeing any cysts. I don't see any discoloration. No swelling or abnormal discharge. So it's good so far. Okay. So I'm going to apply a lubricant. Right, so you're going to feel my fingers in a speculum. It's going to be a cold sensation, but it's just to open up the vaginal canal so I can visualize the cervix, okay? So just take a deep breath, and in 3, 2, 1. Okay. Okay, I'm not noticing any cysts. Okay. Okay. So visually the cervix looks healthy, right? I'm going to be taking some samples. just going to open this. Okay. 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 So I'm going to collect a sample. You're going to feel brushing sensation. And this is for your pap smear. Okay. And okay. Next, I'm going to take a second sample. This is just a test for chlamydia and gonorrhea. Okay. All right. I'm going to take one last look inside before I remove the speculum. Okay. So visually, it looks very healthy. I wouldn't have anything to worry about. We're going to send these tests to the lab, and we'll probably have the results within about 3 weeks, okay? So I'm going to be removing the speculum on the count of 3, and again, take a deep breath. 3, 2, 1. Okay, very good. Okay. And lastly, I'm going to apply an antiseptic spray just to the general area. Okay, so that should keep you sanitized. You're going to feel a little bit of soreness probably for the next few days. That's normal. But if you feel any unbearable pain or any very severe pain, definitely give me a call, okay? I'm going to have you sit up right now and we're going to talk over the results. So I'm just going to write over what we did today. We did a general exam with your vitals. Blood pressure was normal. We did the breast exam. Okay, and that all turned out very normal. We looked at your abdomen. Okay, I didn't see any visual or feel any signs that there's a problem. With your bloating, I would recommend ibuprofen helps, but also, do you drink coffee?
I do.
Okay. Well, some people have a reaction to coffee that can cause a buildup of acidity in the stomach, which can result in bloating. It's not everyone that experiences this, but I'm thinking that maybe just as an experiment, you could give coffee a break.
Okay.
Maybe for about 2 weeks, and then just see how you feel.
Okay.
Okay? Okay. So we did the pelvic exam, pap smear, okay? And test for chlamydia and gonorrhea. Okay. And so those results are going to be on your portal online. Do you have a profile?
Yes.
Okay, so go ahead and check that. If it's anything abnormal, I'll give you a call. Okay, but if it's normal and if there's no issues, it's just going to show up on the portal and you'll get that within 3 or 4 weeks, okay?
Okay.
Do you have any questions?
No.
Okay. Thank you for allowing me to do this exam. And have a great rest of your day, okay?
Thank you.
But you look great, in great shape to me.
Okay.
Okay.